One of our favorite and most long-lasting activities is to publish Future Children, along with our colleagues at Princeton, which we've been doing for, I think, about a decade now. And we published, I think we've published 20 volumes or close to it. And they are all have to do with children. Every volume focuses on a certain issue. And this volume, of course, actually focuses somewhat on two issues, which is foster care and juvenile justice. So we're very pleased to be involved in this activity, and especially in this volume, because it's a little different than we've done in the past. I want to just very quickly summarize how this event is going to proceed. So the first thing is, after I get through, John Laub, who was the editor of the volume and spent untold hours editing a volume. There's nothing like editing a volume of Future Children. I'm sure he had all great authors, no doubt, but occasionally there are authors that aren't great, and that gives a extra addition to the task. So John did that, and he's going to describe the volume to you in a very abbreviated version, but hopefully get you interested, and the copies are available outside. And then I'm going to talk briefly about our policy brief. We always have a policy brief. We identify one issue in the volume that we think has traction in Washington or in the state capitals and possibly could have some influence on policy, and I'll describe that very briefly. And then we will focus, after that we'll have a panel of people who were involved in the volume and people who are not involved in the volume but who know about policy. And they are going to focus only on the policy brief. Once the description of the volume is done, the rest of the event focuses just on the policy brief. In both of these cases, with Robert Sampson from Harvard, who will give a background talk, which I can hardly wait to hear. He has fantastic slides about neighborhoods and families, which is a big background, very important for this issue, and we've learned a lot in recent years about this issue. We used to talk about neighborhoods all the time, as you can tell by looking at me. I've been around a while. And I was always impressed by, we didn't know very much. And we've learned so much in the last decade or so, and Robert's been right at the forefront of that movement. So that will be very interesting. And then we will conclude with an opportunity for you to ask questions to the panelists. And then I'm going to bound up here right at 3 o'clock and say bye-bye, and the event will be over. So we have also, I didn't mention this to people, but I think we have 300 people on the web, so welcome to them. We have no way for them to ask questions, so all the questions are for this audience. John.
Thank you, Ron. I just want to give an overview of the Future of Children volume called Reducing Justice System Inequality. And basically, to start with, the topic of inequality in the United States has become virtually impossible to ignore, and the justice system is an important part of that discussion. Witness the recent National Research Council report on the causal consequences of high rates of incarceration in the U.S., especially for minority offenders. I've also heard heated debates about stop, question, frisk in New York City as well as other places around the country. And more broadly, the legal scholar Michelle Alexander has referred to mass incarceration and other justice system policies as the new Jim Crow in America. When considering the known facts, though, about crime, offenders, and victims in the justice system response, important complexities arise, both that reflect and contribute to inequality in the wider society. The fundamental fact is that criminal offending and victimization for common law crimes are not randomly distributed across persons and places. Inequities are present in the patterns of serious criminal offending and serious criminal victimization, even before any contact with the criminal justice system. We could think of these known facts as input to the justice system. At the same time, the justice system's response often exacerbates inequality amongst young people in America. We could think of these responses as output from the justice system that reinforces and deepens inequalities. For example, researchers have increasingly studied the collateral consequences of justice system involvement. So the distinction, the analytics distinction between input and output suggests while crime and justice involvement are typically considered to be outcomes, crime and justice involvement can also drive inequality. So I have the table of contents of the volume on this slide, and just want to talk a little bit about some of what I see as the distinctive features of this particular volume. First off, I wanted to cover the entire justice system, starting with stop, question, frisk by the police, and continuing through the various stages of the justice system into courts and corrections. Secondly, it devotes special attention to schools, in particular school suspensions, and the role of the police, known as school resource officers, in schools. Third, it covers 3 domains that contribute to the reproduction of inequality, but have received little attention from researchers and policymakers. These 3 domains are foster care, probation, and jails. And finally, most important, it assesses policies, practices, and programs that can reduce justice system inequality. What strategies have worked, what strategies should be tried, what strategies should be avoided. Given the bipartisan support for criminal justice reform, especially at the state level, now seems a particularly good time to take stock of what could be done to reduce justice system inequality, and each article in this volume assesses such policies, programs, and practices in detail. Thus, this provides a much needed evidence-based voice in discussions of criminal justice reform. So the first 2 articles in the volume focus on schools and foster care, both of which can be viewed as feeders to the justice system. The notion of a school-to-prison pipeline has received a fair amount of attention in public discourse. However, less attention has been paid to the possible foster care to prison pipeline. Each article, in turn, interrogates that issue. The next article looks at one of the most popular reform strategies for reducing justice system inequality, diversion away from the justice system. Along with decriminalization and deinstitutionalization, diversion was a popular juvenile justice policy during the 1970s, and I believe it's worthy of consideration today as a possible strategy to reduce the criminal justice footprint. The next 4 articles, the remaining 4 articles, deal with various aspects of the justice system: policing, jails, incidentally one of the least explored aspects of the justice system, mass probation, and parental incarceration and child well-being. So each article in the issue highlights the justice system disparities with respect to race, ethnicity, and socioeconomic status. Moreover, the authors make abundantly clear that the justice system policies affect not just individuals, but also families, schools, and communities at large. The articles discuss strategies that may well reduce justice system inequality, but I'd like to make several points that put these recommendations into a broader context. First, it's not easy to change policies to reduce justice system inequality, especially with regard to racial disparities. For example, a recent report by the Sentencing Project shows that although the number of youths sent to juvenile facilities after adjudication dropped by 47% between 2003 and 2013, racial disparities didn't improve. In fact, the gap between black and white youth in secure confinement increased by 15%. Second, in any of the topics covered in the issue, we cannot ignore the enormous variation in the treatment of youth and the consequences of they experience. Such heterogeneity is evident in school experiences, foster care placements, interactions with the police, jail stays, and probation experiences at the individual city, county, and state levels. Third, data on crime and justice responses are notoriously weak. We need stronger data and a broader research infrastructure to successfully translate research into effective and fair justice system policies. Fourth, there are important gaps in our data. For example, we know very little about LGBTQ youth in the justice system. Similarly, there are important gaps in our research. We need more research on topics such as alternatives to out-of-school suspensions, the effectiveness of consent decrees in police departments, and establishing the best programs for the jail population, to name a few. The fact is, we often lack the causal evidence regarding the effects of policies, programs, and practices in the justice system. And fifth, we need to move beyond assessing what works to assess why something works and for whom. To do so, we need to test the underlying mechanisms of our policy interventions. In the meanwhile, we can do better. We do know that the justice system exacerbates inequality, and we must change the policies and practices that do so. In an interesting article, Harvard economist Sendel Mullainathan advocates a different approach to reducing inequality using the metaphor of headwinds and tailwinds. Perhaps a more fruitful strategy for the justice system might be to remove headwinds, which make progress difficult, and at the same time provide tailwinds, which help us move forward. The authors in this issue call for removing headwinds by such means as reducing out-of-school suspensions, ending cash bail, and lessening the conditions of probation. They also call for creating tailwinds. For example, extending foster care beyond the age of 18, providing community-based alternatives to jail, and creating place-based and school-based services for the children of incarcerated parents. So in closing, I'm very excited about the Future of Children volume, and I thank all of the authors. All wrote excellent papers, Ron. And I also thank Sarah McClanahan for allowing me the opportunity to serve as editor. A huge thanks to John Wallace, the managing editor of the journal, and thanks to the staff at Princeton and Brookings for their help with this volume and for this event. Thank you very much.
Well, in 10 years, that's the most succinct overview of a volume we've ever had. That means I can talk for a half an hour. Okay, do I have my slides up there? I guess I can do this myself, maybe. Okay, someone has to help. Ah, there we go. Okay. All right, so here's what I want to do. I want to talk, first of all, about the number of kids who are involved in these systems. Those are extremely impressive numbers about how many kids that we have involved in these two systems. It's millions of kids. So if something is not good, if it has negative effects on kids, that means that a lot of kids are going to be affected. And especially, it will mean that it has impacts on, has diverse impacts on different parts of the different types of children, especially, as John just mentioned, on black kids. Secondly, we talk about the link between being in the system and negative outcomes. That's the whole point here, that there are negative outcomes, and there's a fair amount of data on that. And then we want to talk a little bit about the ideas that we have for fixing some of those problems, or at least addressing them. John has hinted a little bit at this, and I'll be even more explicit, that most of the things that we propose to do, we would not expect huge success. We don't have easy solutions that we say we can really solve these problems, even though I think we ought to keep trying, and we've got some ideas at least. All right, so here are the number of kids with an incarcerated parent, 2.6 million kids with an incarcerated mom or dad at any given time. And a lesson for sophomores in statistics is just looking at something at one time gives you a very different picture than when you look at it over time. And so as you can see here, there are actually more like 5 to 8 million kids who are involved during the course of their childhood in having a parent who's incarcerated. So again, if there are negative impacts on child development or other aspects of the child's life, then it's a lot of kids that are being impacted. There also are very substantial effects of differences between white kids and black kids. Around about 4% of white kids have an incarcerated parent compared to 25% of black kids. And that difference is intensified if you look at black kids who are born to a high school dropout. There it goes all the way up to 50%. So that's really a huge impact, and a real, if you can show that these are negative impacts, we're talking about a very large number of kids, and even more important in this case, a large percentage of the population. So that's a great concern. There also are a huge number of kids involved in the foster care system. Now, this system is really complex. The article in the chapter is super on this point. It has a number, it has very good text, but even better, figures and tables that explain what happens to kids that go into the foster care system. It's a very complex system. So first of all, there are 6.2 million kids. These are data for 2013. And there were 6.2 million kids who were referred. We have laws about this stuff. People like doctors and teachers and so forth, they must refer if they suspect that there's been abuse or neglect, any kind of mistreatment of a child. So there's 6.2 million of those. They reported to CPS, which is the local agency that runs this whole system, and there are 3.7 million screened for further review. So they're screened into the system. The rest are eliminated on the grounds that it's not really, there's no credibility. And in most of those cases, there probably really isn't credibility. There could be a mistake here and there. So now we're down to 2.4 million victims that we need to figure out what really is going on. And so CPS has the assignment of looking into those cases interviewing whoever's necessary, going to the school, going to the parents, doing whatever's necessary to try to establish facts about the case and determine whether there are sufficient facts that they need to do something about it. And it turns out after all that is done, the kids go in which direction, and again, they're beautiful illustrations in the article about where they go and the different systems that they go to. Some remain at home, some go into children's homes of various sort, some go into kinship care. There are various arrangements for the kids. About 230,000 a year wind up in foster care. I'm going to show you one chart about that in just a second that I think you'll find interesting. And it's useful to say to you that there are a whole raft of reasons that kids get referred and get taken into the system. It's not just one thing. We generally use the term they're either abused or neglected, way more neglected than abused. And there are all kinds of different types of abuse. So there's a range of things that happen to these kids that get them accepted into the system. I thought it might be interesting to show you this chart, which goes through 2015 over a long period of time since 1982. And as you can see, during the 1980s, the number went up very substantially of kids in the foster care system. These are expensive cases, so we spent a lot more money as the years went by on the kids in the foster care system. Probably the main factor here, there's lots of arguments about this, so I'm not saying this is the whole thing, but the main factor here is drug addiction. And so that reached a peak, started to decline a little bit, and sure enough, the caseload started to come down. It came down quite substantially. I can rarely think of a case like this where some big public system like this had such a change. And it's probably due, there was an emphasis throughout this period that foster care is not necessarily the best thing for kids, so maybe we ought to try to keep kids out. I'm going to come back to that later. So that may have played a role, but I think it's primarily the change in things that went on outside the system that influenced this very important measure of what the system had to face. You can see that there are impacts on cases entering the system as well. This is, again, a very complicated relationship between people entering the system, the total in the system, and people exiting the system. So you have to consider all those. You can only determine the total number in the system by looking at exits and entrings into the system. And the worst thing is, if you're trying to really think through this and figure out what we can learn from it, the reason that people enter the system and how they can exit the system and what they go to when they exit the system are often different. And so this is a very important consideration for people who are running these systems in the states. So incarceration, as you might expect, is linked to a number of negative outcomes. There are articles in the paper. I think they'll probably be at least mentioned, if not discussed in more detail, during the panel discussion. And some of these are very interesting, very solid studies. So you can see aggression, grade retention, depression, homelessness, and again, as we'll see in all these cases, racial differences, other differences as well, in family income differences, but racial differences, and kids who wind up having a parent who's incarcerated. And we have pretty much the same sort of thing for, let me go back here. These are negative outcomes for children in foster care, a somewhat wider list, but I think they overlap very substantially. I would bet you that if we looked at the entire literature, the specific problems that having a parent incarcerated and being in the foster care system, that there's just a ton of overlap in the various negative outcomes. So I think they're really, the thing to emphasize here is the breadth of the outcomes that occur. And then there is direct evidence of a link between kids who go into foster care and their likelihood that they will eventually be in the justice system. So here are some statistics that are taken from an article primarily in the journal, and maybe that'll be discussed here, I'm not sure. But 7% of prisoners report ever having been in foster care, as roughly around the half or maybe 0.75% of kids in America are in foster care system at some point. And in any case, I think every estimate's under 1%. So already at 7%, we're way above, it's a much higher probability. And then if you look at people in the justice system, 18 to 21, it's 15%, which is much higher. And then if you look at kids who age out of foster care, and those are the kids that are in the most trouble in many cases, about half of them are incarcerated by their mid-20s. So these rates of incarceration are very high for people who are in the foster care system. So there is this very direct link between foster care and the justice system. We want to avoid these effects as much as we can. Again, this will be taken up in more detail on the panels. It's obvious that the number one idea, I think, is that we need to keep people out of the system to the extent that we can. I think this is the real most important development in incarceration now in recent years, is that more and more people, including people who heretofore were hell-bent to throw as many people in prison as they could, and they're beginning to understand there are lots of negative consequences to that, not just cost, but many others as well. So keep them out of the system if you can, and a lot of these effects that we're worried about here will be minimized. And similarly, if you have to put people in the system, get them out as quickly as you can. Don't leave them in for long sentences. There's a whole set of research on long sentences. John probably knows way more about this than I do, but in many cases, long sentences do not necessarily serve a great purpose. Pretrial bail and other ways of keeping people out of prison, as I said a few minutes ago, and there's beginning to be a literature on this as well, is a very helpful way to go if we could keep more people out of the system by getting them to promise to other things, to commit to various approaches to solving their issue. And this, of course, all these would allow them to remain in the community, remain in their jobs, maintain their family ties. All of these are the best ways to insulate people against the problems that occur with committing more crimes. And then John has a number of ideas about how to improve visitation for parents who are incarcerated. The kids need to see them. They need to see them under pleasant circumstances. It doesn't necessarily help a kid to walk through a jail. I don't know, I'll never forget the first time I went into a jail in Mississippi. I thought, oh my God, we keep people in this situation. That's not necessarily good for a kid, so we need a huge improvement in visitation. In foster care, there are many things that we could do. Again, reduce placements, increase the stability of placements, increase quality of treatments. Here's a sad fact. Most of our treatments in the problems that lead to foster care are not successful. In fact, there's a clearinghouse in California that keeps track of these things, and they show that about 7% of well over 300 treatments have any evidence that they produce significant impacts. So our treatments are not that great. That's something that we really need to develop because only then will we be able to really solve the family's problem. Otherwise, we're going to be left with these kids. Maybe foster care is not the best, but if you can't send them back to their family, you still have to deal with the problem. So we have a lot of big problems here. We have the beginning of some solutions. We have some things that we think have pretty good evidence on, but we can conclude this. There are lots of kids in the system. It's not necessarily declining very much. There's no question that both systems exacerbate the differences between ethnic groups and racial groups in the nation. There's no question that we have modestly effective programs, so we're not really beginning to solve these problems at a very high level. That we need much more testing of possible solutions, and that we need changes to policy, especially in keeping adults and kids out of these settings. So with that, back to John.
Thanks, Ron. It's my pleasure to introduce my longtime friend and colleague, Robert J. Sampson. Professor Sampson is the Henry Ford II Professor of the Social Sciences at Harvard University, founding director of the Boston Area Research Initiative, and an affiliated research professor at the American Bar Foundation in Chicago. Professor Sampson was elected to the National Academy of Sciences in 2008, is a fellow of the American Academy of Arts and Sciences, the American Philosophical Society, and the American Academy of Political and Social Science. He served as president of the American Society of Criminology in 2011-2012, and in 2011 he was the co-recipient of the Stockholm Prize in Criminology. Professor Sampson has played a leadership role in the social sciences throughout his directorship of 3 major programs of research. In the 1990s, he was the scientific director of the Project on Human Development in Chicago neighborhoods, which collected original longitudinal data spanning individuals and neighborhoods, and that has produced 2 decades of research from scholars around the world. In 2011, he was appointed as the director of the social sciences at the Radcliffe Institute of Advanced Study at Harvard University. In that position, he launched the Boston Area Research Initiative and then became its founding director. This initiative has grown to encompass multiple universities and is now supported by the National Science Foundation. Professor Sampson's research and teaching cover a wide variety of areas, including crime, disorder, the life course, neighborhood effects, civic engagement, inequality, ecometrics, not econometrics, ecometrics, and the social structure of the city. He is the author of 3 award-winning books and numerous peer-reviewed journal articles. His most recent book, The Great American City, Chicago and the Enduring Neighborhood Effect, which won the Best Book Award from the American Sociological Association, the American Society of Criminology, and the North American Regional Science Association. Please join me in welcoming Professor Robert Sampson.
Good afternoon. Thank you, Ron and John, for hosting this event. It's a terrific event that Brookings puts on, and I'm honored to be here as a speaker. Also because the Future of Children series, in my opinion, is a real wonderful institution, really. It's been going on for a while, and I read it, and those of you who haven't yet read this specific volume, because it just came out, but it's available as you come in and go out, you should really pick it up and take a look at it. And those of you on the web, make sure you download it. So what I thought I would do today is to place the report in a larger context. The panelists are going to go over some of the more detailed aspects of it. It's already been discussed a bit, and I think the role of a keynote is to kind of paint the larger picture, in particular because I agree with really everything that's said in the report. I think it does a masterful job of going through the different components of the system and noting how they are really interrelated, and puts forth a number of policy proposals, which will be discussed later. So what I thought I would do is to essentially push it a little bit further and connect the report to some larger issues, because my basic conclusion is that I don't think you can address any one of these, let's say incarceration or foster care, without really fundamentally tackling other aspects of inequality. And so I'm going to put out a conceptualization, if you will, about how to think of these, reflected in the title of my talk, the idea of inequalities as concentrated and compounded. I'll elaborate on that. I will then give you a little bit of taste for some empirical findings based on my own work, but also that of others, that shows what I'm talking about across multiple dimensions, not just one. And then I will conclude with some ideas for a policy approach, not so much a specific policy, but a policy approach that integrates with the report in the future of children. So that's the plan, and I'm told I have to do this exactly on time. So here we go. First, some what I think of as sort of key facts that might be relevant in this particular context. One is very basic, and that's just the idea of neighborhood concentration, or more generally what I think of as the spatial foundations of inequality, but in this case, criminalization. Neighborhoods, or the spatial division of cities, is really one of the fundamental features of not just American cities, but actually many cities, and in fact, even if you go way back in time, archaeologists have discovered evidence of division and inequality in ancient cities. So it's something that is quite durable, and the idea of concentration is one thing, but then when mixed in with the fact that it's really not about, let's say, just incarceration. It's about a number of different phenomena, or I think of it as a cross diverse phenomenon, hence the idea of compounded adversity. And this traps families and communities, and I'll push that idea a little bit further. So you have spatial concentration, then you have it across multiple phenomena. And then wrapped around all that, this is the theme of the report, which is very consistent with the research, are deep racial disparities. Again, across multiple phenomena, not just one. Furthermore, these disparities are not new. They are really deeply embedded in, well, the history of America, if we want to really paint the big picture. But depending on the specific phenomenon we're talking about, these are quite enduring, which is not to say they're immutable. And we need to attack these, and there are positive things we can do. But we need to start with the premise that these things are compounded, they're enduring, they're deeply racially divided, and they are spatially divided. So let me give you a few examples of this. And I'll start with a report at the Brookings Institution on incarceration. That's part of what the report is about. And here you're seeing what the authors called where future prisoners are born, which is essentially the spatial distribution, in this case, at the commuting zone. Think about it as a larger community level across the United States. And of course, you can see that it's anything but random. There are pockets of deep concentration, other areas that have relatively low incarceration. You can pick out your spot and figure out whether you're low or high. I'll note here, just so you can keep this in mind, these are for cohorts that were born between 1980 and 1986. And so sort of, again, the idea of where they're born. If you think about it, these are now, many of them, becoming parents. And given intergenerational consequences, we may then see, and I think we do see it very strongly, an intergenerational spatial concentration. Moreover, these cohorts are the very same era, the same cohorts as some of the children and some of the longitudinal findings I'm going to talk about in a few minutes. But it's more at the neighborhood level. It's not just at the community level. Let's take a dive into Chicago, a city that I've studied a lot over my career, although we could do this for any city. And it's a persistent spatial concentration, or in this particular article, called it punishment's place. The idea that it's really somewhat misleading to think of mass incarceration. It's actually not mass ecologically. Many communities come across virtually scot-free. I don't think this works. But, well, it kind of does, but not on the white. Northern part of Chicago, the rates are very low. You can see on the west side and down on the south side, very high rates of incarceration. So it's very much circumscribed by neighborhood. If you go to a later time period, you basically see the same thing, a little bit of spreading out with an increase in the rates over that time, and again on the south side and on the west side. So you have this local concentration. But consistent with the theme that I started with, it's more than just concentration. And again, in this case, we're talking about incarceration. But it's also highly racialized. Those neighborhoods on the west side and the south side are predominantly minority neighborhoods, and specifically African American. And what this shows kind of puts it together by neighborhood. A couple things going on here. The x-axis here is just the incarceration rate in the earlier period, and on the left-hand side is the incarceration rate about 10 years later. And what you can see, first of all, is remarkably a straight line. I mean, you often don't see data like this. There's almost no variance across outside the line. That is, it's almost 100% of the variance explained, meaning that communities that are high incarceration at one point, 10 years later, and also have high rates of incarceration. But what we also see is that in the top part of the screen are predominantly African American communities, and what you can see is this gap in the middle. There's no overlap really in the distribution. Predominantly white communities at the bottom. And if you take the one community, I talked about this in my book, Clearing, that is the predominantly white community with the highest rate of incarceration for whites in Chicago, compare it to the highest rate for blacks, a rate of 40 times higher. So not double, not triple, 40 times different. So you can see this profound difference. Okay, let's move on. It's not just incarceration, as I said, and this is going to be a key theme. Violence is a profound problem in society, especially exposure to violence among children. We've shown, that is to say, social scientists, the deleterious effects of exposure to violence over the life course on a number of outcomes. Here is a very simple plot that shows the murder rate proportional to the population. The larger the star, the higher the homicide rate. And then it's shaded by what I'm calling child health. This is low birth weight and infant mortality. You can see that where there's low child health, there's also extremely high rates of violence. We also see this relationship hold even when we control for poverty. So there's this link between exposure to violence and child health. And there's a lot of rich research on this now, looking at the effects of violence on not just child outcomes, but on mothers, particularly during pregnancy, and the stress in the environment on the health of children. And so when you combine incarceration and violence and poverty in these same communities, you have a very problematic environment. We can even call it a toxic environment. In recent research, my colleagues and I have extended our work to look at other risk factors that work through biological pathways. And in this case, we were able to obtain blood lead level tests from millions of children in the city of Chicago, and these are plotted out by the percentage of children above the level of concern set by the Centers for Disease Control. You're starting to see patterns here. So the west side and the south side, the same ones where we saw high violence, poor child health, high rates of incarceration. Also, children are exposed to highly toxic environments. The red, you can't read it, but just so you can think this through, 76% or more of the kids are tested positive for levels of lead above CDC concern. Okay, 76%. We're not talking about one or two neighborhoods, we're talking about entire swaths of the community. Furthermore, we've shown the link between racial composition, poverty, exposure to smelting plants, and the prediction of this. In further research, we have shown the link between exposure to lead and health outcomes and delinquency outcomes among our children. To summarize on the neighborhood level, we have what I think of as legacies of inequality that stretch back a long time, 50 years. And I put this one up here because 50 years, it's now the celebration of the birthday this year of Martin Luther King Jr. It's also 50 years since the release of the Kerner Report on the riots in 1967. And the riots and the neighborhoods that King was marching for are, again, the ones we were looking at earlier on the west side, places like North Lawndale, the original, quote, inner city of Chicago, Washington Park, Woodlawn. These are the areas in the dark that were racially segregated in 1960. Okay. So we're going way back. And the pluses are areas where over the next 40 years you saw increases in concentrated poverty. And you can see it's the same areas and it's pushing further south. And then furthermore, when we take a macro level event like the Great Recession, we've already seen the macro level event of mass incarceration. It is disproportionately laid onto the city. Again, it's not just spreading out evenly. These are the areas that are hit by high foreclosures, which were previously hit by the other things I've talked about. So again, you get this cumulative and concentrated disadvantage. Okay, neighborhood level. Now I want to just drill down a little bit more in terms of the lives of individual kids, which I've alluded to, but I want to talk about it a little bit more. Very briefly from a study John mentioned that I've been working on for a long time, and others, the Project on Human Development in Chicago Neighborhoods. It's a longitudinal study of children. It started in 1995 with a birth cohort, and then 3 cohorts age 9, 12, and 15. I'm going to focus on those, what you're going to see in a minute. So the average age is about 12. And it's connecting more or less to those cohorts that you saw in the earlier Brookings picture. A lot of the early work was presented in my book, Great American City, but I'm moving beyond that because we did a new data collection after the publication of the book. I won't get into the details. We followed people wherever they moved in the United States. And what I want to look at right now is what I think is a really important indicator, which is living in poverty and also being exposed to a high poverty neighborhood. In other words, Bill Wilson famously argued, it's one thing to be poor, it's another to be poor living in a high concentrated poverty neighborhood, which we define as greater than 30% poverty and living in the bottom fifth of individual income. And what I'm going to show you now is the transition to adulthood, following our kids from 1995 to the recent past. And basically, since it's 12-year-olds, we're talking about the home, child's home, right? The income of the parents, poverty rate as a child, and then around age 30 to 32, the attained neighborhood of the child as an adult, and the adults, then child to adult income. So this is, in a sense, an intergenerational examination. And we've seen a lot of work by the Chetty team on income. I want to focus on this more disadvantaged population, which connects to the incarcerated and foster care population. And these figures, I think, were even surprising to us. If we look at the predicted probability of being in that state, compounded poverty, conditional, I can talk about this more later, conditional on individual differences, family background. Along the bottom here, as you go along from 1995 to 2013, the black line is Latino children transitioning to Latino adults, and then whites in the dotted line. And basically the story there is relatively low exposure to compounded poverty. Latinos doing worse, as you would probably expect, than whites at about a 2-to-1 ratio, but nonetheless at an absolute level that's relatively low, so about 3% for Latino Americans. However, African Americans in our sample are basically a world apart, not even close, starting out at 15%. Now again, we're not just talking about poverty. This is simultaneously individual and neighborhood poverty, what we might call the concentrated, truly disadvantaged. And what you notice, too, is that there was some improvement. And what happened at wave 3? Well, you can kind of guess. In my earlier slide with regard to the Great Recession, basically that happened here, and our digging into the data suggests that that uptick happened after the Great Recession. So there's good evidence to suggest that there was a loss, and in fact, at the end, by the age of about 30 or 32, African Americans, these are men and women, were higher than at baseline and about a 16-to-1 ratio to whites. So again, no comparison. Controlling even for all the characteristics that economists typically look at in terms of human capital attainment, self-control, measured IQ, family characteristics. Can't explain this. So that is, I think, a fact that has to be considered in the present discussions. Getting now more closely into the discussion here of incarceration, the point I want to make here is I think that I agree with everything in the report, but I want to make the broader point that people that are incarcerated were also convicted. They're also arrested. Not everybody that's arrested is convicted, though, and not everyone who's convicted is incarcerated. There's good evidence to suggest that there are negative effects of conviction on, for example, getting a job, same thing with arrest. And these things also are clustered together, not only multiple aspects of the criminal justice system, but I want to broaden the definition of families. And the focus a bit is on parents, right? So children of incarcerated parents, you have an incarcerated father. Well, but maybe the father's not in the household. Maybe the father's never been in the household. But there are family members, and many households are complex. there are people moving in and out. There are grandmothers, grandfathers, uncles, aunts. And it turns out, based on our search of criminal records, going well beyond, and these are not self-reported, these are looking at, in most cases, going into records, that if you have a parent that's arrested, as this example in the black bar, then about twice as likely to have an aunt or uncle in the family context that has a criminal record, sibling in jail, or if we look at aunt and uncle in jail, pretty high proportions, about 5% if the parent is arrested, cousins in jail. And, this is important if you often, especially in ethnographies, look at the social arrangements, the social organizations of deep poverty. The reliance on kin and family members and cousins and aunts and uncles is an important phenomenon. So the criminal justice system is not just interacting with the parent. It is this broader context, which I think makes it more complicated in terms of dealing with policy. And I think the implication for me anyway is that it really needs to be child-centered, because you got to capture all this. You can't just focus on the parent. Now connects to the point I've been making about racial disparities and the proportion or the prevalence of interaction with the criminal justice system now gets even higher. So this is looking at, it's probably hard to read, but on the left is any family member. So now I'm not just limiting it to the parent, but if get family members arrest, you can see that about 44% of blacks have any family member arrested. That's just a baseline. Fully 20% in jail, compared to only 5% of whites and 3% of Hispanics. So you really do see not just a racial disparity, but what's interesting in these data is that for arrests, Hispanics are much more at risk, but for jail and prison, less so in these data in terms of the longitudinal. And then if we go to the later longitudinal follow-up, this is the criminalization that just is occurring going from wave 1 to 2 and wave 2 to 3. And you can see that it's shockingly high. That is not cumulative, but just in the period going from baseline to the follow-up about 2 years later, about 29% had an arrest among African Americans compared to 12% of whites, and 28% of blacks compared to 11% of whites at wave 3. So what you really see here is this breadth of criminalization of families and its impact on children. Okay, now I want to conclude, keeping on time. So I want to propose, and maybe we can have more discussion about it, that these facts seem to me to suggest the importance of what I call a community-based approach. And one idea here, or motivation for this, is that community-based approaches, I think, have been shown to have an important effect on the violence reduction in the United States. That is to say, this is a huge trend, right? We know that crime or violence has dropped overall. And recent work by Patrick Sharkey, a paper in the American Sociological Review, also in his book, has shown that community nonprofits, I'm not going to get into the details, but nonetheless, the density of community nonprofits that are providing support services to youth, neighborhood crime prevention, counseling, job supports, were shown to have a causal effect on the reduction in the violence rate. So we have evidence then to believe that communities that have strong base of nonprofit organizations, or what I like to think of as a collective efficacy, especially collective efficacy among residents that's linked to organizations, is powerful for the control of crime. And that's important, given what I've said and shown you about the role of violence in American society and the role of violence in undermining children's development. So why not apply this to incarceration, but more broadly, criminal justice reform? In other words, we have all these facts in the sense of declines in incarceration. It's been noted. This is happening, it's real. But what does that mean? It means people are coming out into the community. I'm a little less sanguine, by the way, about that fact, because we're kind of celebrating that. That's good, but we're talking about very vulnerable people that are being released. If you just give someone a ticket, they have to go somewhere. They're going to go into a community. That community is going to be one of the most likely concentrated, disadvantaged communities that I've been showing you that has all these other problems, drug problems. We now have the opioid epidemic. So there has to be an integration of new kind of policy, not just decarceration. The report talks about alternatives to prison, new visitation, reentry support. I think that all makes sense. But again, I think it has to be coordinated, and I think it needs to have a community level basis. Secondly, I want to say we can't let go of the violence reduction. I think that we're going to see increases in violence. There's going to be disruption in some of these communities. There's going to be public backlash. We have to be prepared for that, and I think we need community-based organizations to confront that head on. And I really do think of the community-based organizations as perhaps the unsung heroes in all this. And finally, then, the idea would be something like community or neighborhood-based centers for children in trouble, and that's how I titled my keynote here. Because it really is children in trouble, and I use that purposely. It's children in trouble across multiple domains, not just parents incarcerated, but families incarcerated with alcohol problems, drug problems, arrest, convictions. And I think this could be coordinated in two ways. One is person-based, that is using the children as the center, really, which would then capture all the points of disadvantage with respect to that child and his or her family. And remember, complex family members that are moving in and out. And secondly, place-based, that is linking organizationally the crime, health, housing, poverty, education efforts. All these things, I think, holistically need to be integrated to deal with the problem. So the specifics of this, I'll leave it for Brookings to solve and all of you. But hopefully I've presented you with a set of empirical and conceptual tools to be able to think this through more effectively. Thank you.
Rob, I think you purposely went over a bit because you didn't want me to ask you any questions.
I don't know.
So I'm just going to ask a couple, and then we'll open it up for the audience. I want to push you a little bit on the second to last point about nonprofit organizations, and ask you, what is it about those organizations that seem to be effective? You referred to collective efficacy, but could it be more than that? Could it be that these organizations actually work with the police? Could it be that these organizations work with kids? Or could it be all the above?
Yeah, so, well, I guess the easy answer is all above, but let me not take the easy answer and say that, first of all, I think the social is important. The collective efficacy, the extent to which the residents are working together with the community organizations, I think is powerful. And many of the interventions, I think, if I could put it this way, it's kind of banal in terms of what some of these do. I mean, we're talking about supervision of kids, mentoring. These are relatively small things, but when added up, make a difference. And I think that's especially important for children in high-risk environments, often especially where you have a high proportion of the men who are not in the community through being jailed, incarcerated, higher mortality rates. And one of the things we see in high poverty neighborhoods is differential sex ratios that would be consistent with that. So the collective support and mentorship for kids, I think, is an important piece of it. As I noted in the Sharkey study, the nonprofits were involved in multiple things. It wasn't just one. So it was sort of, job training for older kids, mentorship, and working with the police is, I think, an important component. Now, I'm not sure we've done a great job of that in the U.S., and I think both sides have had some problems with it. But I want to emphasize one other thing. That's the social. I also believe strongly that there's good evidence that physical infrastructure of communities matters too. So, for example, the rehabilitation of the physical infrastructure in neighborhoods is important. Something as simple as cleaning up vacant lots, putting in playground. There's a recent study out of Penn that showed, based on a randomized design, that cleaning up a vacant lot and putting in a park and a garden has all kinds of spillover effects. And people begin to think, well, this is now a safer space, or at least it's a place you can walk and be, and then kids start to be in the environment and play, and then it becomes, right, self-reinforcing safety. And it showed it did have an effect. We don't often think about interventions like that as crime reduction, but I think in part they do. So I would argue for the community organizations to have a fairly broad mandate. I think the old way of thinking about it was purely just crime prevention, like neighborhood watch, right? You put a sign up, we're watching. I mean, that doesn't really do or mean anything.
Okay. Another question. Are there important gender differences by race? In other words, do black girls and black women fare as poorly as black boys and black men with respect to concentrated and compounded adversity?
Yeah, that's a good question. Now, depends, I guess, on how you want to think about fair worse. So clearly with regard to things like violence, that is the victimization by violence, we want to take something like homicide, death, mortality. If you want to take incarceration, males have much higher rates. Mm-hmm. That's true of all races. So that's kind of I think of that as a main gender effect. Now, the different question is there sort of differential causes that get us there? And some of the recent work of Chetty has shown that, for example, in terms of intergenerational mobility, that the race differences are almost exclusively due to black male, white male differences. That is to say, once you condition on parental income, black females are doing as well as white females in terms of intergenerational mobility. But here, that's a different phenomenon. Right. So here we're talking about crime and incarceration and deep poverty, and I didn't present it by gender, so I don't want to speak beyond the data, but my sense is, given the prevalence of differences, that I think the problem is worse, mainly driven for black men, driven by the intensity and the prevalence of the contact with the criminal justice system, but also some of these other adversities that I've talked about. So, for example, just another one is the, lead poisoning. Black boys are more likely to be poisoned.
I'm going to email you my remaining questions because I want to open up things to the audience. So, questions from the audience, and I would ask that you wait for the microphone, and if you could introduce yourself before you ask your question. So, there's one here, I think.
Hi, Naomi Riley from the American Enterprise Institute. There were three factors that you mentioned in your talk that make me wonder about the possibility how feasible it is to reduce the number of kids in foster care. The first one you mentioned was, maybe Ron mentioned it, the very low percentage of family interventions that seem to be effective. The second was how many relatives, how many members of extended family are also incarcerated or involved in the criminal justice system. And I'm trying to remember what the third one is, but I'm just kind of wondering in terms of this idea of reducing the number of kids in care, whether that's feasible given the difficulty of providing services that allow kids to stay with their family, and also given that there may not be as many alternative responsible or capable adults in the community or in their extended family who could be caring for them.
Can I just say that I wonder if that would be a question better posed to the panelists, where we'll be focusing on the issues of foster care. And I don't want to take privilege as the moderator here, but I think in terms of that particular question seems could be answered best by the panelists, and we could actually start with that after. Is that okay? Okay.
I would just second it, though. I mean, in the sense that, no, I think you're right that it's a real challenge because, you know, who's going to pick up the slack? You know, again, it's analogous to the incarceration. If, well, too many kids in foster care, and there's this overlap, but then, okay, if you don't, you have to have an alternative. And it seems to me anyway, but the panelists can talk about it, that there doesn't seem to be, at least in the present state, with funding, current administration, viable strategy in place.
Question over here.
Charles Feinberg, Interfaith Action for Human Rights. Professor Sampson, thank you very much for your presentation. It was really quite interesting and educational for me. The thing I'd like to ask you, though, is whether you and your... I work in advocacy in this area on human rights issues regarding prisons, and there just seems to be this incredible gap between what people like yourself and your colleagues know, the facts that you talk about, and what the policymakers, the politicians actually know and what they act on. Just for instance, the state of Maryland, in its recent legislative session, passed a comprehensive crime bill in which increased mandatory minimums both for felonies and misdemeanors. And this is just a few years after they had what they call a joint reinvestment committee. In order to save money, they could put more money into services. And the chair of the Judiciary, the Senate Judiciary Committee, didn't even call a committee hearing so that supposedly expert witnesses could give a testimony. So there's just, and he was quoted in the paper saying, well, the only way we can reduce people from recidivating is just to keep them in jail longer. And so is there any attempt by you and your colleagues to try to get more information out in a consistent way to the policymakers, specifically to the politicians?
Well, I guess I could give you my positive and then cynical answer, which positive is that, I mean, I think social scientists, I think everyone in this room, everyone on the panel, this event have tried, you've done a number of different things, whether it's through publications, briefings, op-eds, there's variants around, in terms of academic researchers, how much they do that. I think there's a lot that's been put out there that's very clear. Let me give you one example. I served on the National Academy of Sciences panel on the growth of incarceration, causes and consequences. Major study, consensus panel that went on for over 2 years. It had experts from across, you name the disciplines, and it was appointed by the National Academy of Sciences. Jeremy Travis was the chair, along with Bruce Western, produced a report that just laid out a lot of these facts. I believe it had a positive impact, and I think that that kind of report, and it's not the only one, but there is evidence out there. That's the positive side. The cynical side to me says it's out there, and that the things that you are describing it is that there are many, I think, in the policy world that they don't want to know the answer, or they disregard it. And it's based more on a normative stance, a decision on the appropriate response to crime. And it is independent of the evidence. So no amount of reports, no amount of briefings can change that. That's just, in my view, the reality. So sorry to say that, but that's the reality.
Mark, and then.
Yes, Mark Maurer with the Sentencing Project. Looking at Chicago, there's been a lot of concern in recent years, the rising rate of homicide after nearly 2 decades of decline. Lots of debate about the causes of it. Just yesterday, Attorney General Sessions says it's all the fault of the ACLU. It seems like it's a sort of de-policing argument he's giving. I'd be interested in your take on what we know or what you suspect may be going on to explain these relatively short-term but disturbing trends.
Sure, it's a good question. Chicago. So, yeah, Chicago has been used as sort of a punching bag by the administration in terms of violence, what's happening there, murder capital of the world. Not just because I live there and wrote a book on it, but I need to defend Chicago a little bit. It's not the murder capital if we calculate rates, which is fairly elementary, and administration seems not to have been able to make that calculation. And it's actually not one of the highest rates of violence in the country at all when you look at the homicide rate per 100,000. That's one thing. Secondly, the rate of violence was going down in Chicago as it was in other cities. It did not decline at the same rate as Los Angeles, New York, and others. And scholars are still trying to figure that out. And there's no clear, I don't have an answer to that. I don't think anyone does quite yet. But the recent spike in the 2015-16 correlated anyway with a lot of unrest in Chicago around police shootings, Laquan, and that was a very that year saw an incredible spike. But last year it came down, and this year it's down. So my prediction is I don't think that's a long-term thing, and there's a lot of work going on now in the police department, particularly work in specific communities, focusing on better police community relations, better use of technology in terms of like solving crimes. That's one indicator, for example, in terms of the number of crimes they're able actually to solve. That went way down, and those are the things they're addressing. So I think that things are actually, at least my prediction is going to plateau and not continue to spiral out of control there. But I think that, again, there has been this emphasis on the violence increase, and it was used nationally. There was an uptick. And in different cities you see it. But we're not in the world that we were in the 1990s in terms of the high rates of incarceration. But just to go back to what I was saying before, especially with decarceration, we know, it's a fact that has been demonstrated for decades, and that is recidivism. And we know that a certain proportion of released offenders are going to recidivate. So therefore, there is going to be crime. And that's why we need a plan to accompany decarceration. And the trumpeting of sort of success because there's decarceration, in my view, is premature. And especially since, and it goes to the last point, as soon as we start to see this on a consistent basis, any kind of uptick, there will be a backlash, which is why policy has to be ex ante ready for this.
Do we have time for one more timekeeper?
You have 1 more minute.
Can you be brief and you be brief?
I can be brief. My name is Roger Gordon. Most recently, I was the president of Defy Ventures, a prison-based entrepreneurship training program. My question has to go to decarceration, recidivism, and undiagnosed mental health problems in communities of color where these problems are most acute. So what is the effect of undertreated schizophrenia and significant mental illness on collective efficacy, and in particular police-community interaction?
That's a great question. I don't know the answer to it, specifically on schizophrenia. What I would say is, and I think some of the facts here are not all in, because I'm going to tie it to the opioid epidemic, right? So, going back earlier, the institutionalization of the mentally ill, I think there's consensus, or at least good evidence, that that's connected to homelessness. And in this most recent era, I think we're seeing in a lot of cities an increase in homelessness, and because of untreated mental health problems, substance abuse and addiction problems. And furthermore, when you have the vulnerabilities among prisoners coming out, and we see this in, for example, Bruce Western's recent work on life in the year after prison, the connection of substance abuse problems, mental health, violence is huge. And if you layer on that the opioid epidemic, I think what we're seeing in a lot of communities is a lot of unraveling. And what I like about your question is that sense of sort of unraveling and disorder in communities is then potentially going to undermine collective efficacy of the community, or perhaps the willingness of residents, the motivation to actually do something about it, right? It's going to lead to a sense of, an overwhelming problem. So I think that has to be tackled. And I don't think at the federal government level it is at all being tackled in the way it should be.
Thanks, Rob. Please join me in thanking Robert Sampson.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.